Now we're talking about um, moving on to talk about skin disorders in the kids. You let it do what it do. I don't know what that's all. Okay, any day now. All right, coach. Okay, so boom. Y'all don't need to record it. Slideshow. All right. With the skin disorders. Okay, start right here. Skin disorders. So we got the nevi, which is nevis. We know that's an abnormal skin mark, either pigmented or vascular, meaning it has color or it's just vascular. Um, Birthmarks or moles are either simple brown spots or dark spots containing hair follicles, normally harmless, but must be monitored can as they can later develop into melanoma. Okay, a vascular nevus, that's an angioma, vascular nervous, nevus or nevus, angioma. Anytime you see angi, you know they're talking about a vessel. It's either lymphangi- lymphangioma, meaning overgrowth of lymph tissue, or hemangioma, which is overgrowth of blood vessels. So you see the heme, which we know stands for blood, and the vessels is the angioma, as well as with the lymph tissue. Lymph stands for lymph, the lymphatic system, lymph, and then angioma, that's the vessels. Okay? So Mongolian spots are irregular dark blue green area generally found on the lower back. They are almost always present in Asian infants and common in Mediterranean and African infants. If you ever if you have um if you ever saw it, it's just like little green looking green blue mole, big mole on the baby's bottom. So these are the skin disorders. That's what the Mongolian spot looks like. My son used to have it. He no longer has it, and he's fair skinned it, and he still had it. Then you got one right here, one right here. Okay. So let's talk about the rash and eczema. Many babies experience rashes of unknown cause as their skin is very delicate and easily irritated. Eczema is a severe atopic dermatitis characterized by remission and exacerbation, accompanied by vesicle formation, oozing, crusting, ex- excoriation, and itching. Musculoskeletal and orthopedic disorders. Development of dysplasia. Hip dysplasia. When one or both hips are improperly located in the ball and socket joint, the head of the femur is displaced, or the acetabulum develops improperly. The infant or child is placed in a pelvic harness or speaker cast, so the hips maintain an abducted position. It's not adducted, it's abducted position, promoting bone development of femoral head and the acetabulum. So you can see this is the position that their child is going to be in when the head of the femur is displaced or the acetabulum develops improperly. So we're going to put that baby in the pelvic harness or a speaker cast. So the hips maintain an abducted position. That's what it looked like. Talus, which is club feet, talus, club feet. And this word talus, I'm thinking of tadpoles. It look like a little tadpole. That's what little feet look like. I mean, that's what comes to mind when I think of it. a treatable condition in which the foot is twisted or bent out of shape as a result of hereditary factor or an abnormal fetal position. So it can be either hereditary or it can be due to an abnormal fetal position when they were in the womb. Treatment usually includes sequential casting at 1 to 2 weeks interval. Surgery may be needed for older children or severe deformities. So you see what it look like. Oh, baby. So let's talk about torticollis, also called, I guess, says Renet. This is a well, Rhinet. I'm gonna say Rhinet. Congenital torticollis, meaning they were born with it. It's going to be caused by failure of the sterno sternocleidomastoid muscle to lengthen as the child grows. It must be corrected, or curvature of the upper spine will result. So if you don't correct it, they're going to have a curve. Their spine is going to curve. The upper spine will curve. Treatment includes passive range of motion and active range of motion. It also is going to include surgical correcting or casting. So this is what reneck look like, torticollis. Let me see, that's a cast around the baby neck, or surgery may have to take place. And we're also going to do some passive range of motion to try to get it straightened up and active range of motion. Reyes or Rees syndrome, however you pronounce that, that's a neurological disorder. We know that come from administering aspirins to babies. It's an acute, potentially fatal childhood disease that causes swelling in the liver and in the brain. It's a fatal childhood disease that causes swelling in the liver and in the brain. Most often affects children and adolescents recovering from a viral illness such as chickenpox or the flu. So they're going to get this syndrome, um, simply from trying to recover from an illness or chickenpox or the flu. Also, the use of aspirin during the viral illness has also been linked to Reeves or Ray's syndrome. Early symptoms include vomiting, diarrhea, lethargy. Later symptoms are changed to loss of consciousness. The child may start to have seizures due to cerebral edema and impaired liver function. So that's all that takes place with Reeves syndrome. Early symptoms include vomiting, diarrhea, lethargy. Later symptoms or changes to loss of consciousness, seizures due to cerebral edema, and impaired liver function. And like I said, it's going to come from, it's most often affect children who are trying to recover from a viral illness or they're trying to, such as viral illness such as chickenpox or the flu. They're not trying to recover from a bacteria illness, it's a viral illness. So remember that. Because I remember on tests I've had in the past about this at a different school, um, they always try to switch those words, viral and bacteria. Now we have encephalocele. Encep- Encephalocele. It is if the bone in the fetal skull do not close correctly, that's going to be when a portion of the brain may herniate through that opening. Wow. The degree of damage to the child functioning depends on the size and location of the protrusion and if the brain tissue is being strangulated. The sheath danger is rupture of the meningeal sac, which can lead to infection. So that is the chief danger. That means basically like if If there's an opening, if it rupture, that means the skin is not there, because the skin, we know that is a barrier to keep all the bad stuff out. It's a barrier to infections and to keep things out of your body. So if the skin, let's say the skin broke right here, or if the skin broke right here, that child is at risk for an infection, probably meningitis, but they are definitely at risk for infection. You never want any bacteria getting to the brain like that. Spina bifida. Spina bifida is a malformation in which a part of the vertebral column is open or if it's missing, and the condition may be asymptomatic or may cause severe paralysis depending on how large the opening is and whether the meninges or spinal cord herniate through the opening. With spina bifida occulta is an opening with no apparent symptom. The spina bifida occulta is an opening with no, occulta means no apparent symptoms. A small tuft or heart, I'm talking about heart, a small tuft of hair or port wine stain sometimes appear in the area. We learned about the port wine stain. It looked like the child had some red wine to waste on them. That's what it looks like. It looks like a wine stain on the skin. So, a small tuft of hair or port wine stain sometimes appear in that area. Meningocele occurs when one layer of the meninges herniate through the opening. There will be a visible sac on the back, but may show no disability, or they may have muscle weakness, difficulty with bowel or bladder control, or rarely paralysis. So that's what it looked like. Spina bifida. So meningomyelocele, we know that's the spinal cord and the mening. It's the most serious form and occurs when the meninges and part of the spinal cord protrude through the opening. The child is usually paralyzed when this happens with meningomyelocele. So that child is going to be paralyzed. Folic acid taken during pregnancy helps to prevent all forms of spina bifida and other neural tube defects. We have learned that over and over and over again. Nursing goals for spina bifida is to prevent further damage to spinal cord. That's our nursing goal. We're trying to prevent further damage to the spinal cord. We're also going to avoid latex as children with spina bifida are extremely sensitive. That is something that probably would be on the test. Children with spina bifida are allergic, extremely allergic to latex. Hydrocephalus. This is the buildup of fluid in the cavities, ventricle, deep within the brain. So when you see the word hydro, you know that means water. Cephalus means the head, the brain. So the excess fluid increases the size of the ventricle and puts pressure on the brain. With hydrocephalus, that's what we call the children waterhead when they had those big old heads. Because it really is, it's fluid in the brain. Symptoms include progressive increase in head circumference. Treatment is surgically Treatment is to surgically insert a shunt, allowing the fluid to circulate around the defect or blockage. This is called a ventriculoperitoneal, which is a VP shunt. So they're going to get a ventriculoperitoneal VP shunt. And what that shunt does, it allows that fluid to circulate around the defect or blockage. Post-op nursing care for hydrocephalus, preventative skin care to head and ears. So we're trying to prevent any type of um, any type of infection. So we're going to monitor that skin and treat that skin like we should. So preventative skin care to head and ears. Monitor for increasing irritability or bulging fontanelles, which would indicate increased intraocular pressure. Not intraocular, intracranial pressure. I'm thinking about um, glaucoma. Intracranial pressure, ICP. Monitor for signs of hemorrhage or for leakage of cerebral spinal fluid. Because that's all it is. So you got to monitor that. You don't want them to just be bleeding or leaking too much fluid off of the brain. So you're going to monitor the fontanels. You know, there's one right here and there's one right there. It's right up in here. You're going to monitor for hemorrhaging. You're going to monitor for the leakage. Want to make sure that the fontanelles are not bulging. I mean, they're not sitting up like it's not a bump or a lump or something. But that's what we're looking for. When we and make sure that preventative skin care and head and ears to the head and ears. Febrile seizures, generalized convulsion of unknown etiology related to acute illness. Child body temperature rapidly raises above 1.1.8. Treatment is aimed at controlling fever. So we're going to give them fever medicines. We're going to give them tepid baths. And we're going to also, um, there may be other measures that have to take place to try to cool that baby temperature down and get that temperature down. So remember, this is just a seizure from a fever that acutely came on from an acute illness in the child body, and it raises rapidly to 101.8. Metabolic and nutritional disorders, so marasmus, general failure to thrive condition lacking protein and calories. Marasmus, general failure to thrive, FTT, condition lacking protein and calories. Related to such condition as kwashior- kwashiorkor, rickets, and scurvy. Rickets and scurvy come from vitamin D deficiency. Um, I think vitamin C. Symptoms include wasting and atrophy of body tissue. That means the tissues are withering away, they're getting small, the cells are dying, so everything is looking smaller. Unlike Kawashar, I'm fucking this word up. Kwashiorkor, no edema is present. The eyes are sunken, the head is small, and body temperature is low. So that's what's going on. Symptoms include wasting and atrophy of the body with marasmus. Unlike Kwashiorkor, no edema is present. The eyes are sunken with marasmus. The head is small with marasmus, and the body temperature is low with marasmus. The child is generally weak and listless, and physical growth lag behind. The child is going to be weak, listless, and physical growth lags behind. Mental development may or may not be slow, but severe malnutrition in infancy threatens future mental ability. Mental development for marasmus may not be slow, but severe malnutrition in infancy threaten future mental ability. So this is what it looks like. You got rickets, bowed legs that's due to a vitamin D deficiency, or knock knees. You got this marasmus. And with marasmus, what did we say again? That child they look malnourished. So they have atrophy of the body tissue. Eyes are sunken in. Say the head's supposed to be small. These babies' head pretty big, but the head's supposed to be small. And probably if you feel them, the temperature is low. You see him with Kawashi core. Big belly, but body is malnutrition. And their baby also, if they stand up, they probably have rickets or scurvy as well. Um, the children are lacking protein and calories. They're lacking protein, important proteins and calories. Mm, oh, babies. Celiac disease, the most common in children of European descent. Celiac disease is a chronic intestinal disorder involving small bowel formation and nutrient malabsorption. Once again, celiac disease, just the European children, European descent. Celiac disease is a chronic intestinal disorder involving small bowel formation. It's the small bowel, not the big bowel, but the small bowel formation and nutrient malabsorption. Remember, it's a small bowel that's missing it. Children with this disease have an intolerance of the protein gluten found in wheat, oats, barley, and rye. Treatment includes strict adherence to gluten-free diet. Celiac disease is associated with FTT, failure to thrive. So you got to be careful with giving this child. That child got celiac disease. You can't give them wheat. You can't give them oats. You can't give them barley. And you got to stay away from that rye. So remember that. So how we can remember that is um brow, brow, barley. Barley, rye, oats, wheats, brow, barley, rye, oats. That's how we can remember that. Phenyl, uh, phenylketonuria, that's PKU. Hereditary is autosomal recessive. Autosomal recessive. So basically, this means that this is a metabolic disorder where the child lacks a certain liver enzyme needed to break down phenylalanine. So the liver, they lack a liver enzyme that is needed to break down phenylalanine. Phenylalanine is PKU. After the infant has received breast milk or formula for 2 days, at least 2 days now, a blood test can be done to detect PKU. It's after that baby has been receiving breast milk or formula for 2 days. Not if that baby been receiving any type of milk from uh through a tube or something, a feeding tube. It has to be directly from the mama titty, or you can put a bottle in the baby mouth from the formula. And the blood test is going to be done to see if this baby has PKU. All 50 states require screening for this disorder in newborns. All states require screening for this disorder. Treatment is a very low, well, a diet that's very low in phenylalanine, phenyl, phenylalanine, if I'm saying it right. So, PKU, it's inherited error in metabolism. It says, um, like I said, it's autosomal recessive, toxic level of phenylalanine, phenylalanine, common protein, amino acid, due to inability of body to convert. So the body's not converting. And the common protein that it is amino acid that is not, you know, converting like it should. Babies are tested after they have had a bottle or if they had some of these big titties right here, either a bottle or some of these big ass titties. It can cause Mental retardation. It can cause the baby to start having convulsions. The baby might have behavior issues, behavior problems. The baby may have a rash, skin rash. Baby may stink like a motherfucker. Baby got a musty bottle odor. Stinking ass baby. A minimum of 24 hours after beginning milk is when we're going to test, and it's tested in all 50 states. We're going to retest again in 7 to 10 days to catch earlier false negative. So for this baby, unfortunately, they can't have no meat. They can't have dairy products. They can't have none of your mama dry ass beans. These babies can't have nuts. These babies cannot have eggs, cereals, fruits, and vegetables are all going to be in moderation because we're trying to prevent this baby from being mentally retarded. We're trying to prevent this baby from having convulsions. We're trying to prevent this baby from having behavior problems. We're trying to prevent this baby from having a skin rash. And we're trying to prevent this baby from being stinking like a motherfucker. We're trying to prevent the baby from having a musty body odor. And like I said, babies are tested within the first 24 hours, minimum 24 hours after beginning, on the bottle or they on the titty. No meat for this baby, no dairy products for this baby, no dry beans, none of your mama dry ass beans for this baby, no big or small nuts, no eggs for this baby. Cereal, fruits, and vegetables in moderation. Let's talk about the disorders of the eye. Strabismus and amblyopia, or amblyopia, how you pronounce this shit. Strabimus, shit. Strabismus, commonly referred to as a cross-eyed baby, is an inability to appropriate move the eyes. My baby had this, and he had surgery 3 times for this, and it works. It does work. He's not cross-eyed anymore. Treatment includes patching the unaffected eye to stimulate the unused eye exercise, and corrective glasses or surgery. Amblyopia, that's the lazy eye, is subnormal vision in one eye, which may fail to develop due to lack of stimulation because the child always uses the good eye for vision. So, once again, with strabismus is commonly referred to as a cross-eyed baby. So I'm just looking at all those S's in that word strabismus. I probably be mispronouncing it, but I'm looking at all of those S's and it's like it's crossing my tongue up even to say it. So this is a cross-eyed baby or just cross-eyed. It refers to cross-eyed and is an inability to appropriately move the eyes. Treatment includes patching the unaffected eye to stimulate the unused eye exercise, corrective glasses, or surgery. Amblyopia, lazy eye, is subnormal vision in one eye, which may fail to develop due to lack of stimulation because the child always uses the good eye for vision. See, I was about to say Music Soul Child had amblyopia. Music Soul Child didn't have that, baby. Music Soul Child has and still got strabismus, and his trifling ass mama didn't get his eyes fixed like I got my baby's eyes fixed when he was small. It wasn't that he was just cockeyed like Music Soul Child. It was just sometimes you can be looking at him and his eyes start to cross. So Music Soul Child mama down bad for not fixing his strabismus on his ass. But he got strabismus and his ass got amblyopia, which is a damn lazy eye. He got both of them because he got a lazy eye. Ear, nose, throat, and mouth disorders. This is otitis media. Otitis media is the acute infection of the middle ear. Bacteria travel through the eustachian tubes in an infant or child much more readily than an adult. Treatment includes decongestants. We're going to give them antibiotics. We're going to give them fever reducers, and we're going to give them comfort. Surgical interventions may be required if other treatments are unsuccessful. A PE tube, I forgot how to pronounce that, but it's that tube that they put in the baby ear. It's placed in the eardrum, allowing drainage of the accumulated fluid. Okay, so that's what's going to happen for otitis media. If surgical intervention is required, um, they're going to put their PE tube in place in the eardrum, allowing the drainage of the accumulated fluid. But we usually just going to treat it with a decongestant, an antibiotic, a fever reducer, and comfort care. So this is what it looks like. Infection in the middle ear. That's the eardrum. This is the middle ear. Infection in the middle ear. So the middle ear is right here. That's down middle ear, way right down. This is the external auditory canal. This is the outside, and this is the eustachian tubes. It's connected to the nose. It's not a big difference when the child get older. Not a big difference at all. Besides the eustachian tube to move a little bit closer up under the eye. Is that some? Okay, and I see what I did. Why they did that? It's the anatomy. Because this is close to the nose, the eustachian tube. But when you get older, it's right up under the eye. So I can see what's going on. Tonsillitis. Tonsillitis is an inflammation of the tonsils caused by viral or bacterial pathogens. So tonsillitis, it can be either or. It can be viral or it can be due to bacterial pathogen. The symptoms include sore, reddened throat with swelling and sometimes exudate on the tonsils. Treatment usually includes fluid, rest, antipyretics, and antibiotics if bacterial. And for recurrent peritonsillar abscesses, a tonsillitis is usually, oh, I'm sorry, a tonsillectomy is usually performed. So they're going to remove the tonsils if it is recurrent, if it keeps coming back. You keep getting tonsillitis. And it's called recurrent peritonsillar abscesses. If they keep getting them, we're going to have to snatch them bitches up out of there. Tonsillectomy. Hemorrhage is the most common post op complication. So we're going to observe for coffee ground emesis or bloody sputum. We're going to observe for coffee ground emesis or bloody sputum. We're going to encourage clear, bland fluids. Popsicles, jello, sherbet can help with sore throat. Avoid red juices or liquids as it makes it more difficult to detect bleeding. So, no red Kool Aid for this child. No red liquids at all for this child because we don't want it to get it confused with bleeding and call the doctor and he like, this ain't no damn bleeding. This baby just had some some po ass red Hawaiian punch because you know that shit thick and it's for po people. The red Hawaiian punch. So do not give it to them. Avoid the use of straws as this may dislodge clots and cause bleeding. Advance the diet as tolerated. So if they can start, you start off with everything liquid. You start off with sauce. Then you can start off with, and then you can go into a certain class of chicken tender basket. But right now, it's soon after liquids, soft foods. Then we do hard foods or whatever. So advance the diet is tolerated as much as it's up to that child. Cleft lip and cleft palate. Failure of the upper lip and palate to close during the second and third gestational months. Surgical repair is done when the child is still young, and the scar eventually fades as the child grows. Post op care is usually focused on maintaining airway and using proper feeding techniques after surgery. So, once again, failure, cleft lip, and cleft palate is failure of the upper lip and palate to close during the second and third gestational months. Surgical repair is done when the child is still young and the scar eventually fades as the child grows. Post op care is usually focused on maintaining airway, and we're going to focus on using proper feeding techniques after surgery. Baby bottle syndrome. Uh oh, look at the baby teeth. Mm-mm. If bottle feedings continue after the child has teeth, or if the child uses a pacifier, a deformity called baby bottle syndrome can occur. Just look like the baby been on some meth or something. This is caused by the bottle's content continually coming into contact with the baby's teeth for prolonged periods of time, causing dental caries. Prevention would be never prop a bottle. Don't allow child to walk around with the bottle. It's ghetto, and it's going to cause dental caries. Wean to a cup by 1 year of age. Brush the child's teeth after eating. Do you hear me? Never pop a bottle. Just because that baby doing all that whining and crying and shit, you like, oh no, fuck that. Here, get your bottle. No, we're not gonna do that. Because your baby gonna look like they've been doing meth if you do that. Don't allow the child to walk around with the bottle. That's ghetto. Wean to a cup by 1 year of age. Brush the child's teeth after eating. And nobody want to see that green salad in your baby teeth. So make sure that you brushing that shit up out of their teeth. Okay. Cardiovascular disorders. Major cardiac abnormality can be divided into cyanotic defect and acyanotic defect. Cyanotic defects cause a right to left shunting of blood in which deoxygenated blood is mixed with oxygenated within the heart. Cyanotic defects have a left to right shunt, which sends oxygenated blood to be mixed with deoxygenated. So once again, with cyanotic defects, it causes a right to left shunting of blood in which deoxygenated blood is mixed with oxygenated within the heart. Acyanotic defects have a left to right shunt, which sends oxygenated blood to be mixed with deoxygenated blood. So with C, remember C defects cause a right to left. C defects cause right to left. C or L. Ain't that on the computer? C or L? Oh no, CT or L. Well, you can say CT or L. Um, cyanotic to right to left, or C or L. Hell, cyanotic right to left, and then that means when I say right to left, that means deoxygenated blood is coming and it's going to be mixed because deoxygenated blood comes from the right side. Oxygenated blood comes from the left side. I could be wrong in the motherfucker though. In which deoxygenated blood is mixed with oxygenated within the heart. Just know that shit. An acyanotic defect have a left to right shunt, which sends oxygenated blood to be mixed with deoxygenated blood. And it's just something you're gonna have to read on your own. I'm gonna have to read that about 4 more times. Ventricular septal. Hold on. Give me a second. Ventricular septal defect, most common. This is the most common. An abnormal opening is found between the left and the right ventricle. So with ventricular septal defect, there's going to be abnormal opening. It's found between the left and the right ventricle, usually acyanotic, as the higher pressure forms. The higher pressure from the left side causes a shunt from the left to right. Without the presence of pulmonary hypertension and the opening is small, and the child may be without symptoms, and the opening may close without surgery. So that's ventricular septal defect. It's most common. It's the most common. It's very, very common. It's the most common heart defect. And an abnormal opening is found between the left and the right ventricle, usually acyanotic, as the higher pressure from the left side causes a shunt from the right, well, from left to right. Let me read that again. Usually acyanotic, as the higher pressure from the left side causes a shunt from left to right. Without the presence of pulmonary hypertension and the opening is small, the child may be asymptomatic and the opening may close without surgery. Atrial septal defect. This is not common like ventricle septal defect is. Yeah, ventricular septal defect is more, it's the most common. But they can also have atrial septal defect, and this is an abnormal opening between the left and right atria, most occurring in the area of the foramen oval, typically acyanotic. Surgery can repair the defects but become more complicated if the heart valves are involved. So this is typically acyanotic. Surgery can repair the defect, but it's going to be a little bit complicated if we got to include those heart valves. Patent ductus arteriosus, a condition in which, so that means something is blocked, a condition in which, well, no, no, that's not what that means. Nothing is blocked. Patent ductus arteriosus, a condition in which the ductus arteriosus remain open, so nothing is blocked, it's open after birth, and it should be closed. It should not be open. So patent ductus arteriosus, that's the key word, patent. Some is open. It is not supposed to be open. And what's open is the ductus arteriosus. It remains open after birth. The left ventricle pumps blood that should go to the body through the aorta, which is one of the biggest blood vessels in the body. So the left ventricular pump blood that should go to the body through the aorta, but some blood gets shunted back into the pulmonary circulation. So that's like regurgitation. Due to the high pressure of the aorta, this can cause pulmonary hypertension. It's something going on with the fluid, it's the blood. So it can cause pulmonary hypertension, patent ductus arteriosus. Transposition of the great vessels. Transposition of the great vessels. The aorta and pulmonary arteries are reversed so that each connects to the wrong side of the heart. If the ductus arteriosus closes, the child dies as only unoxygenated blood is circulating systemically. Immediate intervention includes maintaining patent of the ductus arteriosus and removing the arterial septum to allow mixing of oxygenated and deoxygenated blood. So this is very serious, the transposition of great vessels. So like I said, the aorta and pulmonary arteries are reversed so that each connects to the wrong side of the heart. So that's what's going on. The aorta is connected to the wrong side of the heart. The pulmonary artery is connected to the wrong side of the heart. If that ductus arteriosus closes, the child dies as only unoxygenated blood is circulating. So they're not getting any oxygen. So they're going to die. And it's circulating systemically, meaning it's circulating throughout the body. It unoxygenated blood is circulating throughout the body. Immediate interventions include maintaining patency of ductus arteriosus. So in this case, you want the ductus arteriosus to stay open. You want it to be patent in the case of transposition of great vessels and removing the arterial septum to allow mixing of oxygenated and deoxygenated blood. So if you look over here, we can see what's going on. We got a better image of what's going on. Normal aorta, pulmonary artery. So this is normal here. This is normal. You got your coronary arteries. That's normal. It's the left side. Oxygen poor blood travels from the heart's right side, which is this side, and so that's okay. So we said oxygen rich blood travels from the right side, then um, it goes to the rest of the body. Oxygen rich blood returns to the heart. Hold on. I'm wrong as fuck. Oxygen rich blood returns to the heart's left side. So I was right when I said that earlier in the other slide. So oxygen is on the left side. It's the left side. I know it's like our right side, but this is the left side. Because it said right there, the left side. Oxygen rich blood. Then it travels through the heart. Then the heart shoots the oxygen rich blood. It goes to the right side, then to the rest of the body. And so oxygen rich blood returns to the left heart side and is pumped out to nourish the heart through the coronary arteries and to the rest of the body. And then over here, this is wrong. This is for transposition of great arteries. So what's happening, the oxygen rich blood, well, nothing is hidden. No oxygen rich blood is coming on this side. So oxygen poor blood is pumped directly from the right side of the coronary arteries into the aorta, unable to go to the lungs for oxygen, and the blood cannot nourish the heart or the body because the left side of the heart is really associated with the lungs. So the reason that it's oxygenated, oh yeah, that it's oxygenated or it's oxygen rich blood is because this blood comes from the lungs. And when it's not going to the lungs, there's transposition of the great arteries. The blood is not going to the lungs because it's blocked off. It's not. It's the arteries are reversed. So because the arteries are on the wrong side of the body or on the wrong side of the heart. So you just got blood just flowing around the body, but it has no oxygen in it because it has to go to the left side in order for it to be oxygenated to go to the coming from the lungs. When you breathe in, like the lungs and the heart, just think about the way God made us. It's just amazing. Oxygen, when you're breathing in, your left side of the heart has a lot to do with your lungs. That is what makes the blood rich in oxygen. So if this side, the left side isn't working, ain't the right side doesn't do that. So ain't no oxygen going through the body at all. It doesn't. It this is the right. That's not the right side job. The right side is to take the oxygen rich blood from the left side and shoot it through the rest of your body, and then it's gonna return back to the left side. It was gonna turn back to the lungs, and then turn back to the left side. So if it's not able to do anything with the lungs, or it's not able to function on the left side, no oxygen is going to go come through the body at all. Tetralogy of Fallot. Tetralogy of Fallot is a combination of four major defects. An infant with a severe defect in any of these areas is cyanotic. Infants with this condition may first be seen as failure to thrive infants and then go on to have periods of hypoxia and cyanosis, known as the blue spells or TET spells. If repair not done, increasing pulmonary stenosis and later develop club fingers and breathing difficulties. That's what tetralogy of Fallot. Like I said, it's a combination of four major defects. An infant with a severe defect in any of these areas is cyanotic. Infants with this condition may first be seen as FTT infants and then go on to have periods of hypoxia and cyanosis, known as the blue spells or TET spells. And this and if this isn't repaired, increasing pulmonary stenosis, meaning the pulmonary, like the lungs, everything is going to be narrow, and later develop club fingers. We know what those look like, big ass balls on the end of the fingers. Just fingers are round and big, the tip of the fingers, fingernail area, and breathing difficulties. So tetralogy of phallic. So that's what the baby looks like. Children with tetralogy of phallic exhibits bluish skin during episodes of crying or feeding. Tetralogy of phallic. Major defects, because we said it's four defects. And the major defects is pulmonary stenosis, as we see here. Come on, where my mouse? Why my mouse ain't doing that? Oh, my bad. Hold on. Shit, I don't know. Man, this shit getting on my damn nerves. Hold on. Mm, mm. Right here. Stenosis, pulmonary stenosis. So that means it's getting narrow. It's really, really narrow right there. And then right here, we're going to have right ventricular hypertrophy, meaning, meaning it's going to be a lot of muscle tissue right here. Muscle tissue is growing and growing and growing, and it enlarges the heart, and we don't want that to happen. Overriding aorta, that's right here, number three. Overriding aorta. And number four is ventricular septum defect, right here. There's going to be a ventricular septum defect. So somewhere up in here, there's a defect. So this is known as TET spell or blue spell. So this is what the babies look like when they cry or when you feed them. You're gonna see a cyanotic baby. Bluish skin start to come about. And the major defects: pulmonary stenosis, right ventricular hypertrophy, overriding aorta, right here, overriding aorta, and then ventricular septal defect. Other cardiac disorders. So you have coarctation of aorta, tricuspid atresia. It's just other cardiac disorders. Portatia of aorta and tricuspid atresia. I don't see her talking about it, so I can't tell you shit about it when I don't know nothing about it. Mm. Kowalski disease, blood and lymph disorder. So we're talking about Kowalski disease. It's just a blood and lymph disorder. So this child may have a fever. So a febrile multi-system disorder resulting in inflammation of the blood vessel. That is vasculitis. It typically occurs in children younger than 5 and is more common in Asia. Kowalski disease. It's a febrile multi-system disorder resulting in inflammation of the blood vessels, vasculitis. It typically occurs in children younger than 5 and is more common in Asia. Symptoms include prolonged fever of 5 days or more. Child may have a strawberry tongue. They may have dry, cracked lips, edema in their hands, their feet, and they may even have a rash. So those are the symptoms of Kowalski disease. Prolonged fever of 5 days or more, strawberry tongue, dry cracked lips, edema in hands, and feet rash. Well, and edema in the hands and feet, and they may even have a rash. So if we come over here, shit. Okay, here we go. If we come over here. So a type of Kowalski that primarily affects the young children and believed to be caused by a non-contagious infection. And these symptoms include pink eye, oral mucosal change. Child may have enlarged lymph nodes. Child may have patchy rash, and the child may even have peeling skin. So basically, it's coronary artery aneurysms. Coronary artery aneurysms. And it's also going to be heart muscle inflammation. Heart muscle inflammation. Anemia. Abnormally low red blood cells. It can occur in kids who are bottle fed for way too long or they are not eating an iron rich diet. Children should be breastfed, which contains highly absorbable iron or iron fortified formula until the age of 1 year to prevent iron deficiency anemia. So, normal amounts of red blood cells, that's going to be what, more than 120? Anemic amount of red blood cells. That's what it looks like. So, you see the difference. Hemophilia, a gender linked hereditary bleeding disorder in which a deficiency exists in one or more of the factors needed for clotting. Internal or external hemorrhage can occur with even mild injuries. Nursing care focuses on preventing injury. Okay, that's what hemophilia. It's a gender linked hereditary bleeding disorder in which a deficiency exists in one or more of the factors needed for clotting. Internal or external hemorrhage can occur with even mild injuries. Nursing care focuses on preventing injury. Leukemia. Leukemia is a group of disorders characterized by malignancies in the bone marrow and lymphatic system. The highest rates occur in children below 4 years old. Survival depends on the type of leukemia, the age of onset, is going to be the initial white blood cell count, and it depends on the gender. That's with leukemia. It's a group of disorders characterized by malignancies in the bone marrow and lymphatic system. The highest rates occur in children below 4 years old. Survival rates depend on type of leukemia, age of onset, initial white blood cell count, and gender. Now, the four major types of leukemia are got the ALL, which is acute lymphoid leukemia. All is the most common kind of cancer in children under 15. ALL, the all of them. I'm just remembering this, all of them. All, ALL. It's the most common kind of cancer in children under 15. Acute myeloid leukemia, AML. Acute myeloid leukemia is the most prevalent for the leukemia, well, for leukemias. Well, most prevalent for of leukemias in adults, usually present in young adults. I don't know. I don't know what they were supposed to say. So most prevalent leukemia in adults, usually presents in young adults. You got chronic lymphoid leukemia, the CLL, and you have chronic myeloid leukemia. I mean, you just had it for a while. You had chronic, where you had acute lymphoid leukemia for a long time, or you had acute myeloid leukemia for a long time. So, acute myeloid leukemia, most common kind of cancer in children under 15. And acute myeloid leukemia, that's when we get to talking about the adults. It's the most prevalent for the leukemia in adults, usually presents in young adults. Leukemia. The symptoms include fatigue, aching in bones, in joints, fever, swollen lymph nodes, unexplained weight loss, frequent frequent bruising, and nosebleed. The symptoms again include fatigue, aching in bones and joints, fever, swollen lymph nodes, unexplained weight loss, frequent bruising, nosebleeds. The white blood cell count is usually elevated with characteristics abnormal cells, and the child is anemic. The white blood cell is usually elevated with characteristics abnormal cells, and the child is anemic. Treatment includes chemo, radiation, possibly stem cell bone marrow transplant, and platelet infusion. That's the treatment. It's going to be chemo, radiation, possibly bone stem cell, which is bone marrow transplant, and platelet infusions. The greatest threat to the child is infection or hemorrhage. So, respiratory tract disorders, upper respiratory tract, and pneumonia. So, with the upper respiratory tract infections, they are common in children and adults, and they may be caused by a virus of bacteria. Symptoms: fever, varying degrees of dyspnea with thick to nascuous sputum and mucus, edema of the throat. General treatment is going to include antibiotics, humidity, and rest. That's what we're going to treat someone with the upper respiratory infection. Antibiotic, humidity, and rest. Now, with pneumonia, this is inflammation of the lungs, and it's usually with consolidation and drainage. They have the same symptoms as upper respiratory infection, but with pneumonia, it can be more severe and differentiated from upper respiratory infection by chest X-ray. So the way we treat pneumonia, we're going to treat it with antibiotics. We're going to actually treat it with fluids and make sure that that person get bed rest. So they're going to be on antibiotics, fluids, and bed rest for is the treatment for pneumonia. So those are the respiratory tract disorders. Let's talk about this long ass word, croak. I think this is what Miss Briggs says she going through. So it's called laryngotracheobronchitis. So that's the throat, the trachea, and the bronchi. It's inflamed. So laryngotracheobronchitis, throat. This is a viral infection of the upper airways. Usually follows several days of upper respiratory infection. So this client may have a harsh, barky cough, inspiratory stridor, meaning there's going to be some shrill sounds on inhalation. They're going to have hoarseness and they're going to have other signs of respiratory distress. It affects the larynx, which is the voice box. It's going to affect the trachea and it's going to affect the bronchi. That's why it's called laryngotracheobronchitis. Those are the three things that it affects. And this is more serious in children as the diameter is smaller. Treatment consists of humidified oxygen. We're going to give them expectorants to loosen that thick, copious secretion. And we're going to treat them with some fever medicine and we're going to make sure that they have fluids to also help break up all that shit up in the laryngo the larynx, trachea, and bronchi. So this is a viral infection of the upper airway. Usually follows several days of upper respiratory infection. Remember, this is a viral infection. This is not a bacterial infection. It's a viral infection. Asthma. This is a chronic inflammatory condition of the airway affecting millions of adults and children, characterized by edematous airways and excessive mucus production, which can cause airway obstruction. So it can block the oxygen, and blocks that your airway. Triggers include strenuous exercise, cold temperatures, high humidity, some medications, allergens like dust, pet dander, pollens. It can also be caused by stress and air pollution. That is what can cause asthma. The triggers include, well, the triggers include strenuous exercise, cold temperatures, high humidity, some medication allergens like dust, pet, dander, pet dander, pollens, also with stress or air pollution. And asthma, once again, is a chronic inflammatory condition of the airways affecting millions of adults and children. And is characterized by edematous airways and excessive mucus production, which can cause airway obstruction. With asthma now, the acute attacks are usually triggered by lung irritants. Acute attacks, when they come on rapidly, this got something to do with the lung irritants. As I stated before, they can be the pet dander and shit like that, and just dust mites and stuff like that, or someone smoking. Wheezing commonly occurs during an attack as expired air is pushed through obstructed bronchioles. So that's why they're wheezing because the bronchioles are obstructed. It's like they are what's a better word for it? Like they're narrow. They're extremely narrow, or some of them are just strictly obstructed. So other symptoms include coughing. They're going to have difficulty breathing, and they're going to have some chest tightness. Prevention is the most common aspect of this treatment. So whatever causes it, we're going to prevent that from happening. Stay away from those triggers. And if they, if you know you're going to be around smoke or it's going to get a little dusty, you should take your medicine way ahead of time. Drug of choice is bronchodilator and steroids. Bronchodilator and steroids is the drug of choice. Cystic fibrosis, a multi-system, chronic, and lifelong condition resulting from major dysfunction of the exocrine glands. This is a multi-system, chronic, and lifelong condition resulting from major dysfunction of the exocrine glands. It affects the respiratory system and the GI system, which is the pancreas and the liver is going to be affected with cystic fibrosis. It's going to affect the pancreas and it's going to affect the liver. Mucus producing glands secrete abnormal quantities of thick mucus, which collects in the child's lungs. It collects in their pancreas and in their liver, disrupting their normal function. That's what happens. Mucus producing glands secretes abnormal quantities of thick mucus, which collect in the child's lungs, the pancreas, and the livers. Now, with cystic fibrosis, it can be hereditary or it is a hereditary disorder characterized by lung congestion and infection and malabsorption of nutrients by the pancreas. It's a multi system chronic and lifelong condition resulting from major dysfunctions of the exocrine glands. It affects the respiratory system and GI system. So it's going to affect the pancreas, it's going to affect the liver. The mucus producing gland secretes abnormal quantities of thick mucus, which collects in the child's lungs, pancreas, and liver, disrupting their normal function. So, what you think happened if the lungs start filling up with a bunch of mucus? This child is having a hard time breathing. Symptoms may occur at any age. Failure to thrive despite a good appetite is common. A hard, non productive cough may be the first indication. Frequent respiratory infections follow. This child is going to have a barrel chest due to oxygen. This child is going to have club fingers due to the lack of oxygen. And they're going to have signs of malnutrition may be evident. A sweat test shows elevated levels of sodium in the sweat. A sweat test is going to show elevated levels of sodium in the sweat. With cystic fibrosis treatment, during an acute respiratory infection, large doses of antibiotics are given to prevent the infection from worsening. That's during an acute respiratory infection. We're going to give large doses of antibiotics. They're going to be given to prevent the infections from worsening, to maintain optimal pulmonary functioning. Chest physical therapy, inhalation therapy, and prophylactic antibiotics can be used. That's in order to maintain optimal, meaning the best pulmonary functioning. We're going to do chest physical therapy. We're going to do inhalation therapy with this child, and prophylactic antibiotics can be used. That helps with the to get optimal pulmonary function. Now, as far as the pancreatic enzymes, they are useful in counteracting pancreatic insufficiency. So, the pancreatic enzymes are useful in counteracting pancreatic insufficiency because we know cystic fibrosis, it can affect the pancreas. This child is going to need a high calorie, high protein, moderate fat diet should be followed. A high calorie, high protein, moderate fat diet should be followed. So this is what we see in a child that is suffering from cystic fibrosis. The diet, like we said, the trick. Well, let's talk about the symptoms. The symptoms are child is fatigued. Of course, you're fatigued when your lungs aren't doing what they're supposed to do, when they're filling up with fluid, filling up with all that mucus in there. They're going to have a chronic cough because their lungs are filled up with the mucus. So it's an irritant in there. They're going to have recurrent upper respiratory infection. It's this thick, sticky mucus. They're going to have chronic hypoxia, which can lead to clubbing or a barrel chest. They're going to have malabsorption. Well, it's going to be a decrease of malabsorption of vitamins and enzymes, especially the pancreas enzymes. They're going to have abdominal distension. of course, because you got fluid building up, mucus and stuff building up. They're going to have a decrease of digestive enzyme because, as I stated before, the pancreas is being fucked over. They're going to have rectal prolapse, unfortunately, rectal prolapse. They're going to have sticky stools, fatty, sticky stools, which is known as steatorrhea. I probably messed that word up, but steatorrhea. There's going to be meconium ileus in the newborns. In the newborns, you're going to see meconium ileus in the newborns. Um, they they're sweating out a lot of salt. If you do a sweat test on them, it's going to be salt. So that's why you got the salt taste on skin or salty snacks and pretzels. If the GI tract, the pancreas, the liver, all of that is, acting up. They're lacking vitamins. Vitamins, they need them. They're lacking enzymes. They have to take those things. So the treatment is we're going to increase that calorie, increase the protein, high calorie, high protein diet. So pulmonary therapy would be chest physiotherapy, postural drainage. That's what the chest physiotherapy is going to be, postural drainage to get all of that, pulmonary therapy. We're trying to get the that thick, sticky mucus up out of them. We're going to do breathing exercise with them. We're going to do aerosol therapy with them. The medications will be antibiotics. We're going to give them their vitamins. We're going to give them aerosol bronchodilators, mucolytics. We're going to give them pancreatic enzymes because they're lacking all of that. So that's what we're going to give them. GI disorders, which is pyloric stenosis. Pyloric stenosis, as we know, stenosis is the narrowing. Get that baby throwing up in that damn man face like this. I would have threw the whole damn baby away. But the child pyloric sphincter thickens, narrowing the canal where food passes from the stomach to the small intestine. As a result, the child regurgitates food into the esophagus, causing projectile vomiting. Other symptoms include weight loss, hunger, irritability, and dehydration. That's what the pyloric stenosis. This is a child pyloric sphincter. It thickens and narrow. Well, there's going to be a narrowing the canal where food passes from the stomach to the small intestine. So the pyloric sphincter has thickened and it has is narrowing the canal where the food passes from the stomach to the small intestine. So now when that food can't go into the small intestines like it needs to, the baby is going to regurgitate. So they're going to be throwing up their food. And it's going to come into the esophagus, causing projectile vomiting. And that's projectile because that shit shot up in his damn face. Other symptoms include weight loss. The baby gonna stay hungry because the food isn't that they're not able to keep their food down, so they're gonna have weight loss too because the, the food is not getting to the intestines to do what it needs to do to be distributed amongst the cells in the body or the organs in the body. The baby's hungry. The baby got a damn attitude. It's irritable, and that baby may have become dehydrated. Of course, we know dehydration can happen when you're vomiting. Hernia. Hernia is a protrusion of a part of an organ through an abnormal opening. It's a protrusion of part of an organ through an abnormal opening. There are various types of hernias, which include you got diaphragmatic. This is the portion of the intestines protrudes through the diaphragm. You have umbilical. This is a portion of the intestine protrudes through a weak umbilical ring, producing a bulge at the navel. I've saw this. I remember seeing a little girl in elementary school with that big ass hernia because I thought it was so cute, but hell, it ain't cute. Your ass had a whole damn fucking hernia. And I wanted the belly button like her so bad. Thank you, Lord, for not giving me that. Then you have indirect inguinal. This is the intestine protrudes through the round ligaments into the inguinal area and may descend into the sac. It may descend into the scrotal sac. That's indirect inguinal. Intestines protrude through the round ligaments into the inguinal area and may descend into the scrotal sac. Then you got direct inguinal. It protrudes through the weakest part of the abdominal wall. It the direct inguinal is going to protrude through the weakest part of the abdominal wall. It goes directly to the weakest part of the abdominal wall. That's how I'm gonna remember direct inguinal. Indirect going to the scrotal sac. So this is what hernias look like. See, in the right corner at the top, that's the type of belly button she had, and I thought I wanted the belly button like that so bad. I'm just thankful God didn't do me like that. And then look at the babies with a hernia. You know, a lot of old men be getting hernias down there in the scrotal area. See where they get transverse inguinal canal. So you got indirect hernia. Let me read indirect hernia. So it's a transverse inguinal canal. Some with same course as spermatic cord. It enters inguinal canal at the deep inguinal ring, lateral to the inferior epigastric vessels, and it can pass into the scrotum or labia majora. So this can happen in girls too. So it can either go into the labia majora, which is the coochie lips on the side of the coochie lips, or it can go into the scrotum. So it can be either male or female. It doesn't matter. Hernia doesn't discriminate. It can be due to congenital or it can be due to an injury. So it can happen to the girls, and you're going to see it in the labia majora since we don't have bowels. Our bowels is our damn labia majora. Okay. And then with direct hernia, it's a bulge through weakened fascia of human wall. I'm sorry, of abdominal wall. Bulge through weakened fascia of abdominal wall directly behind the superficial inguinal ring. So it's the medial to the inferior epigastric vessel. Rarely are you going to see direct hernia to enter the scrotum. The direct hernia is common in elderly men with weak abdominal muscles. So let me go back to that. So it'll be through the stomach. It'll be a hernia in the abdominal wall in the stomach. Well, in the abdomen. Abdomen. A lot of it says it's common in elderly men. A lot of people that get hernia also are alcoholics. So think of an old man drinking a lot of alcohol, putting that bottle directly in his mouth, and that damn hernia is directly in his abdominal muscle. And for indirect hernia, this can be congenital injury. It can happen in females, it can happen in males. It's going to happen in the coochie lips, indirect hernia. So it's going to happen in the coochie lips, which is the labia majora, or it's going to happen in the bowels, which is the scrotum. Diarrhea. Diarrhea is a sudden increase in frequency of loose, watery stools. Causes can be due to pathogens in the GI tract. It can be due to stress. It can be due to prolonged temperature elevation. It can be due to spoiled food, or it can even be due to antibiotics. Antibiotics will send your ass to that bathroom. Medical treatment is going to include oral rehydration. Oral rehydration. We're going to give them, oral rehydration solutions such as Pedialyte, clear liquids, avoid liquids with sugar, so no sugar, no Kool-Aid. We're going to give you like um, Powerades and stuff like that, Gatorades, no Kool-Aid. You're not getting any caffeine. either. No Coca Colas. We're going to get broth with high salt content. You're going to get broth with high salt content because if you got diarrhea, you're losing a lot of potassium, you're losing a lot of sodium. So we got to put that back into your body. Age appropriate diet should be offered within 24 hours. So there's oral rehydration solutions such as Pedialyte, clear liquids, avoid liquids with sugar, avoid caffeines, broth with high salt content. Age appropriate diet should be offered within 24 hours. Diarrhea may also consist of the treatment may consist of IV fluids based on the electrolyte studies, replace water loss, restore fluid and electrolyte balance. Nursing consideration, transmission basis. So precautions, maintain accurate I and O records, describe the amount of diarrhea, and describe the character of the stool. You're going to check that patient daily, their weight daily. You're going to provide skincare to keep, because he probably can break down and the behind can become emasculated. I think that's the word. It's an E word. It's an E word. I can't think of the damn word. Um, keep clean, dry, and keep clean, dry, and clean. And you want to provide protective ointment in that area in the booty. Unfortunately, my baby going through this shit now. I don't know where he get this shit from, but I got him locked up in his room. Encopresis, if I'm saying it right. This is incontinence of feces without physical cause, occurs in previous toilet trained children. Once again, this is incontinence of feces without physical cause. It's not even a physical cause, just incontinence of feces. So encopresis, I guess they're just shitting on themselves. Occurs in previously toilet trained children. Typically, it happens when impacted stool collects in the colon and rectum. The colon becomes too full and liquid stool leaks around the retained stool. So that's what happens. Typically, it happens when impacted stool collects in the colon and rectum. So this sound like this child is stopped the hell up. So the colon becomes too full and the liquid stool leaks around the retained stool. Treatment, improving family relationships, understanding personality patterns, non judgmental, non punishing approach from family caregivers is fundamental to therapeutic plan. So that's the treatment. Improving family relationships, understanding personality patterns, non judgmental, non punishing approach from family caregivers is fundamental to therapeutic plan. Because, a child that's shitting on themselves, it's something going on. So we're not going to judge them. We're not going to beat their ass. Just got to try to understand what's going on. Lactose intolerance. This is inherited disorder. This disorder is going to be inherited, characterized by ability to metabolize lactose in milk and milk products. When lactose ingested, its presence also interferes with the absorption of other foods. Symptoms are going to be diarrhea, abdominal pain, vomiting, listlessness, and failure to thrive. Those are the symptoms for lactose intolerance: diarrhea, abdominal pain, vomiting, listlessness, and failure to thrive. The infant is switched to lactose free formula. The infant is going to be switched to lactose free formula. Yogurt, which has inactive lactose, is an excellent source of calcium. So if that child can't drink milk, we're definitely going to give them yogurt because it's an excellent source of calcium because it has inactive lactase. Intussusception. This is the telescoping of one bowel part into another, usually caused by hyperactivity in one bowel part and hypoactivity in another. Oh, no. Cardinal signs are abdominal pain and the passage of a current jelly like stool. So it's a clear mucus with blood. Hmm. Lord have mercy. Red currant jelly. I can see somebody trying to put that. Oh Lord. Let me stop. I was gonna say for the damn witches out there doing witch bitch shit. Try to put that try to put that shit on somebody damn toast. Anyway, like I said, interception. The telescoping of one bowel port into another, usually caused by hyperactivity in one bowel port and hypoactivity in another. Telescoping of one bowel port into another, usually caused by hyperactivity in one bowel port and hypoactivity in another. Cardinal signs are abdominal pain and the passage of a current jelly like stool. It's going to be clear mucus with blood. That's interception, characteristics of stool. So that's what it's looking like. You got a hyperactivity in one bowel port and hypoactivity in another. Now, with interception, the primary concern with this disorder is that the bowel blood supply may become blocked, leading to gangrene and possible bowel rupture. Surgery is definitely required if that bowel does not reduce on its own. The passage of normal blood stool indicate reduction of interception. So, when you start to see, okay, well, this stool is looking normal again. It's not looking like, that jelly looking current, the red jelly looking shit, starting to look normal again. That means there's a reduction of intercession. How you pronounce that shit? Intercession. Megacolon. See what a normal colon look like? And then you see what an enlarged colon look like. A megacolon, aka Hirschsprung disease. Hirschsprung disease is a megacolon. A megacolon Hirschsprung disease is a condition in which the colon lacks parasympathetic nerve supply. So that colon is going to lack parasympathetic nerve supply in the megacolon, aka the Hirschsprung disease. Excuse me. The colon lacks parasympathetic nerve supply. You see what a normal colon look like? Then you see what that big ass enlarged colon of Hirschsprung's disease look like. Megacolon. The lack of parasympathetic nerve supply. What it's going to do is it's going to lead to a lack, I guess it's supposed to be of peristalsis and the abdomen. Let me read that over. Megacolon. Due to the lack of parasympathetic nerve supply, what it leads to is a lack of peristalsis and the abdomen becomes abnormally enlarged with stool and flatus, which is gas. So the symptom is going to include diarrhea, constipation, nausea and vomiting, abdominal distension. That is the symptoms for megacolon. It's aka Hirschenberg sauce, whatever, Hirschsprung. Let me see how you pronounce it again. Hirschsprung's disease. So once again, symptoms include diarrhea, constipation, nausea, vomiting, abdominal distension. Effects can be seen shortly after birth when the newborn fails to pass meconium in 24 to 48 hours. Preventing constipation is important. So we're going to give saline enemas. Saline enemas. We're going to give stool softeners. And we're going to give digital removal of impaction or done. So that means you got to go in with the fingers, baby, and dig that shit up out their baby ass. Drugs that act on the parasympathetic nervous system may be given to improve peristalsis. So we may have to give drugs that, you know, turn on the turn on the parasympathetic nervous system to help improve peristalsis. So that's megacolon, aka Hirschsprung's disease, which is a condition in which the colon lacks parasympathetic nerve supply. Now let's talk about these urinary system disorders. You got enuresis. This is involuntary passage of urine, usually at night, in children older than 5. This happens in children older than 5, and it happens at night. It's involuntary passage of the urine. They can't help it. Complete urologic workup to look for physical cause. So we're gonna get down there and see what the hell going on while the child is pee-peeing on themselves. If no physical cause is found, then the provider can investigate possible emotional problems. Is there some type of family stress at home? Is there some type of school stress? Certain medications can be helpful at improving continence if problem persists. Let's talk about hemolytic uremic syndrome, acute condition in children ages 1 to 10 years, and is the leading cause of acute kidney failure in children. It is caused by an infection of a toxic strand of E. coli. Three conditions occur in this illness: renal failure, hemolytic anemia, thrombocytopenia. These are the three conditions that occur in this illness. It can occur when the small blood vessels in the kidneys become damaged and inflamed. This damage can cause clots to form in the vessels, which clog the filtering system in the kidneys and lead to kidney failure. That is what's going on in hemolytic uremic syndrome, which is an acute condition in children ages 1 to 10, and it's the leading cause of acute kidney failure in children. And it is caused by an infection of toxic strain of E. coli. Three conditions occur in this illness. You got renal failure, hemolytic anemia, thrombocytopenia. It can occur when the small blood vessels in the kidneys become damaged and inflamed. This damage can cause clots to form in the vessels, which clog the filtering system in the kidneys, and it would lead to kidney failure if it becomes clogged. Now, with uremic syndrome, usually presents as a flu-like illness and gastroenteritis. So you may think your child has a flu, or you may think it's gastroenteritis. This child may have nausea, vomiting, abdominal pain, fever, and bloody diarrhea may be present. So once again, nausea, I said present, I meant present. Nausea, vomiting, abdominal pain, fever, and bloody diarrhea may be present. Child appears pale, they look bruised and hypertensive. The child may not pee as often or they may not pee at all. It usually follows the onset of the milder symptoms. So there's oliguria or anuria. Treatment means, well, treatment is management of hypertension. Got to put that baby on dialysis, so they're going to have a blood transfusion, well, along with the blood transfusion, and nutritional support. So, once again, management of hypertension, dialysis, blood transfusion, and nutritional support. Glomerulonephritis, acute post streptococcal glomerulonephritis is the most common form of nephritis found in young children between the ages of 5 and 10. And glomerulonephritis, it results from an immunologic reaction to infection elsewhere in body, most often streptococcal. Initial main symptoms is smoky urine or blood in the urine and malaria. Other symptoms, child eyes may be puffy. They got periorbital edema. They may have elevated blood pressure, BUN, creatinine. Like all of the numbers are going to be off, going to be elevated. So that's what's going on with glomerulonephritis. It's an acute post-streptococcal glomerulonephritis. Is the most common form of nephritis found in young children between the ages of 5 and 10, and it's going to result from an immunologic reaction to the infection elsewhere in the body, most often strep. Initial main symptom is smoky urine or hematuria. Other symptoms is the child may have puffy eyes, or we call that periorbital edema, or they're going to have elevated blood pressure, or the BUN is elevated, or the creatinine is elevated. So the treatments for um, glomerulonephritis would be bed rest, activity allowed when hematuria clears, blood pressure returns to normal. So we're going to give them bed rest, activity allowed when hematuria clears and their blood pressure returns to normal. That's when you can start back being a child. This child is going to have a diet that is high in calories but low in sodium, low in protein, low in potassium because it is a kidney issue. You do not give a person with kidney disease or anything dealing with the kidneys a lot of protein or a lot of sodium or a lot of potassium because they can't excrete it the way they should. And the creatinine number is going to go up. The BUN number is going to go up because the kidney is not functioning the way they should. So the calories can be high, but the diet has to be low in potassium, low in sodium, low in protein. Because if it's high in sodium, even if it's high in calcium, guess what's going up? Their blood pressure. If it's high in protein, guess what they can't break down and it makes the kidneys work harder? The protein. And the creatinine is going to go up. So remember that. Also, there's going to be a fluid restriction if the and the reason it's a fluid restriction because the kidney's not doing what they're supposed to do. It's not excreting off what it needs to excrete off. So that means they're going to be holding on to a lot of fluid, and we don't want to do them like that. And we're going to have to weigh them daily, just in case that is what's going on as far as the fluid is staying on them because the kidneys are unable to excrete the way they should. Nephrotic syndrome. Oh, little cute baby. Changes in basement membrane of glomeruli causes the kidneys to excrete massive amounts of protein. So changement in basement membrane of glomeruli causes the kidney to excrete massive amounts of protein. This occurs most often in children between 18 months and 5 years of age, characterized by generalized edema, proteinuria, hematuria. When you got protein in your urine, you got blood in the urine. Edema is reduced by administering corticosteroids. We're going to limit their fluids and their salt intake. Because these babies are full of fluid. You see in the picture right there? It's a hypoalbuminemia and hyperlipidemia. And look at the dog. Massive proteinuria. And that's what's going on. So changes in basement membrane of glomeruli causes the kidneys to excrete massive amount of protein. So you're losing your protein and it's showing up in your urine, where it's in your urine. Occurs most often in children 18 months to 5 years of age, characterized by generalized edema. So generalized edema, you see it's in the feet, it's not, and where it's really it's all over the body. Generalized edema is all over the body. Localized is if it would have just been in that one area. Generalized edema is all over the body, as you can see in that baby face. That baby face is puffy. That baby is just swollen up. And then you got proteinuria, you got hematuria. Edema is reduced by administering corticosteroids and limiting fluid and salt intake. Edema is reduced by administering corticosteroids and limiting fluids and salt intake. Wilms tumor. Give me a second. Oh, we almost done. Okay, almost done. Wilms tumor. I thought they had something to do with the brain. I guess it's not. Wilms tumor. Uh, Nephroblastoma is a malignant adenosarcoma of kidney, one of the most common neoplasms of childhood. Wilms tumor. It is one of the most common neoplasms of childhood. So, nephroblastoma is a malignant adenosarcoma of the kidney. Usually affects one kidney. The child may be asymptomatic until the tumor is far advanced. An abdominal mass is usually noticed first. The diagnosis is based off of palpitation of the abdomen. We're going to do an X-ray and studies, well, X-ray studies and biopsy. So let me tell you what a Wilms tumor is again. Nephroblastoma is a malignant adenosarcoma of kidney. One of the most common neoplasms of childhood is Wilms tumor, which is a nephroblastoma. Usually affects one kidney. The child may be asymptomatic until the tumor is far advanced. An abdominal mass is usually noticed first. Diagnosis is based off of palpitation of abdomen, X-ray studies, and biopsy. Treatment for Wilms tumor depends on extent of spread. Surgical removal is followed by irradiation of both sides of the spine as well as the tumor site. Chemo is also commonly used. So the treatment again depends on the extent of the spread. Surgical removal is followed by irradiation of both sides of the spine of, as well as the tumor site. Chemo is also usually common. When caring for this child, avoid any unnecessary palpitations of the abdomen preoperatively. Do not palpate this child's abdomen before surgery. The tumor could rupture and disseminate in the peritoneal cavity, drastically reducing prognosis. So do not palpate that child because that tumor could rupture and disseminate in the peritoneal cavity, drastically reducing the prognosis. Child may die. So a sign should be placed over the bed about do not palpate this child's stomach. Do not palpate it. Avoid any unnecessary palpitation. Me as a nurse, I wouldn't touch that bitch at all. That'll be the doctor's job. I'll look at it and I'll listen. You know, do my bowel um, assessment by listening, but I ain't palpating shit. We know about this hypospadias and epispadias. And hypospadias, that's the male urinary meatus, is located at the bottom of the penis because it's called hypo. It's at the bottom. Epispadias is going to be on the top. It's located on the top of the penis. Male's urinary meatus is located on the top of the penis. It can be corrected with surgery and it's not life threatening. Ambiguous genitalia. What in the world? What is that? That's a penis and a coochie? Let's see what's going on here. Ambiguous genitalia is a rare condition in which an infant external genitals don't appear to be clearly either male or female. The genitals may be incompletely developed, or the baby may have characteristics of both sexes. I don't know what you got. Ambiguous genitalia primarily occurs when Hormone abnormalities during pregnancy interrupt or disrupts the fetus developing sex organs. So that is ambiguous genitalia. Ambiguous genitalia is a rare condition in which an infant external genitals don't appear to be clearly either male or female. So we don't know if it's a boy or if it's a girl. We don't know because that baby got an ambiguous genitalia. Um, because it looked like they got a dingling and a cooter cat. Just don't know. Wow. Ambiguous genitalia occurs when hormone abnormalities during pregnancy interrupt or disturb the fetus developing sex organs. Cryptorchidism, we know what this is. It's referred to an undescended testicle. So basically, the balls haven't dropped yet, as old folk would say. It is common at birth, but usually corrects itself without intervention. If the condition does not resolve surgery, we're going to do surgery in early childhood to prevent sterility. So if those nuts don't drop like they should, we're going to go on and do, um, we're going to go on and do surgery to prevent this child from being sterile. They want to have babies when they get older. Hydrocele, an accumulation of serious fluid within the scrotal sac, causing the scrotum to become enlarged and painful. So this hurt this baby. He got a he, he, unfortunately he crawled with a limp because his nuts heavy. He ain't walking yet because he a baby, so he crawling with a limp because his nuts heavy. If the fluid is not reabsorbed spontaneously, we're gonna have to excise it. So we're gonna do an excision and drain that shit, often associated with the hernia. This is hydrocele is often associated with a hernia. That's it.